We now return to the Paul Vandenburgh Show, presented by Trustco Bank on My 4 Albany.
You're on the phone? Okay, we're back. My 4 Albany. Tomorrow, Jim Franco and Jerry DeAngelis, who happens to be a friend of this gentleman. And for those of you that don't know Dr. Harvey Winter, he's been a big part of my radio station since we moved over to 1300 back in 07. I find him to be one of the most entertaining and informative people that I have on my radio station. And the truth is, we've been trying to get him over here since the first week, and we just haven't been able to pin him down.
Yeah.
But we got him here today. He is Albany's sedation dentist. He's our friend, Dr. Harvey Winter. How are you?
I'm doing fine, Paul. How you doing?
Thank you very much.
Thanks for having me. I appreciate it.
Let me tell you the truth about Dr. Winter. This guy is so busy that, right, this has been the problem getting you here, right?
Well, yes and no. The first week I was going to be here, but I went to Florida to see my mom. And,
okay.
Hey, sorry, Paul.
That's legitimate.
But yeah, I've been kind of busy, and yeah, it's good.
Having never done a regular show, and he's in with me once a month. He's on the station every week. When I started doing the show with Dr. Winter, started to find out a lot that goes on in his world. It's pretty intriguing, and I wanted him to come in just to let people know what goes on with a sedation dentist.
Yeah.
And he is online, by the way, at albanysedationdentist.com. Dr. Winter, who's on Cross Keys Drive, which is just off exit 5 of I-90.
That's right.
Sedation dentistry,
That's
which
right.
others are now using in their TV commercials. Again, because you're on television also. Explain to people what that is.
Sedation dentistry is really nothing more than making the patient comfortable so they can get the dentistry they need.
Right.
Now, or they want as well. A lot of people just have a lot of phobia about dentistry. They grew up with the needle, the pain, all that sort of stuff. They don't want to deal with that, and that's kept them away for a long, long time. They just can't bring themselves to go to the dentist. What sedation dentistry does, you give them some drugs, you give them some medication, they're sedated, they're not knocked out, that's general anesthesia. They are sedated, they're comfortable, you go ahead, do whatever they want, you can take 1, 2, 3, 4, 5 hours, get everything they need, go home, sleep it off.
It sounds pretty simple.
It really is. Right? You know, I make it sound simple, and that's my job.
People always, when it comes to a dentist, it was always Novocaine.
And it still is.
It still is.
It still is Novocaine, or that's the generic term, Novocaine. But we still use Novocaine, and I use Novocaine while I'm doing sedation.
Right.
Obviously, the patient, for instance, who is a severe needle phobe, someone can't take the needle, but they can take the drill or the sound and all that stuff, but they can't take the needle. Well, you knock them out, because if they're going to have a lot of needles, if they're going to get a lot of areas worked on, they don't want to know anything about it. Get them sedated, give them the Novocaine, go to work.
How big a problem is this with potential clients? Is it really big people that get that uptight?
Oh, you would not, you couldn't imagine.
Really?
I've had
and it's a big percentage, right, Doc?
It's a lot of, well, ask yourself, people in the audience, ask yourself a question. How many of you out there love going to the dentist? Most people don't like going to the dentist. Most people would rather do something else than go to the dentist. What sedation dentistry does is you can go to the dentist. You don't have to know what's going on. Yeah, right over there.
Right over there.
You don't have to know what's going on. It gives you the ability to get the work done that you want, that you need, and you don't have to care about what's going on. You wouldn't think of having surgery in the hospital without some sort of medical intervention to kind of bring you down. Well, that's what sedation dentistry does. It brings you down so the dentist can go ahead and do his thing.
You did a good job there.
Did I? Thanks.
You did a very good job there.
That's totally unrehearsed.
Well, no. I mean, it's your passion.
That's what it is a passion.
I mean, I never in my life, I never understood that this type of service was available until I had Doctor on the radio show.
You have to understand something. Most people don't like dentistry. Most people don't like the dentist as a rule. They love me, but they don't like the dentist.
They like you. They don't. Okay. It's like they don't like Congress, but they like their Congress.
And when you go to a dentist and he tells you calm down, take it easy, relax, it's okay, it's just gonna hurt. You know, you're the normal one. The guy who likes to go to the dentist, he's not normal.
Right.
She's not normal.
Right.
The ones who really are uncomfortable, they're the normal ones. So if you feel like, oh, I'm really uptight and you hate me and you probably never saw a mouth like mine before, that's not true. You're the normal one. Yeah. We're geared towards you.
Doctor, tell me a little bit about, just so people understand, this isn't just about having major reconstruction done in your mouth.
No.
The least little thing gets people uptight, right?
Walking in the office is enough. The smell, the sounds, that's enough. I've had people, for instance, they don't necessarily have phobias, but they have a severe gag reflex. You know, you just go near them with a mirror or with one of those little picks. You know, they gag. They just can't take it. Right. They need sedation because They need to have their mouths taken care of. There are people who have a hard time brushing because of their gag reflex. They can't bring a toothbrush in their mouth.
Sure.
Serious problems. We have to deal with it. So we sedate them. We do what we have to do. They go home.
Sedation makes life simpler.
Yeah.
But your world has gotten easier over the years, though, as a general practice.
Easier
right?
for the patient.
Right. That's what I mean.
It's easier for the
It's easier for the patient, but you have to keep up to date with a lot of things, obviously.
Like anyone else.
But it's become, the seat in the dentist chair isn't as painful as it was 30 years ago or 40 years ago.
Well, the needle is still a needle.
It's still a needle.
And a drill is still a drill.
Right.
I hate to tell you guys, but it's what it is.
Yeah.
And that's why we sedate, so you don't have to deal with that.
Right.
But a needle is a needle, a drill is a drill, and it's still uncomfortable.
Right.
Maybe because of the history, You think back to the origins of dentistry. You talk about the guys who would get their friend drunk at the saloon and bring him over to the dentist next door to have his tooth pulled.
Right.
Those are the memories. That's what we think about
Right.
when we think of that. And as the years have gone by, that image, for the most part, is still in our minds. And then, of course, when you go to the dentist as a kid, the dentist, thinks you're an adult, so he treats you like an adult. Mm-hmm. You may not be comfortable. You're scared as a big guy. You're a little kid. He's doing stuff in here you don't like. It hurts. You remember that. That's why I'm here.
Okay. I'm ready to leave. I'm just going to leave him here all by himself, which I knew he'd come in here and be quite passionate. Dr. Harvey Winters on Cross Keys Drive. He is the king of sedation dentistry in the cabinet. He gets embarrassed when I say
fine.
that.
Thank you.
He's online at albanysedationdentist.com. We're going to come back and continue with Dr. Winter in a moment. Tomorrow, Jim Franco, Jerry DeAngelis will join me on the Friday show. We're at the CDTA train station. And by the way, Dr. Winter will be with me Monday morning at 6:30 on the radio. We'll come back with Dr. Harvey Winter in a moment here on My 4 Albany. Stay with us.
We now return to the Paul Vandenburgh Show, presented by Trustco Bank on My 4 Albany.
We're back with Dr. Harvey Winter, the king of sedation dentistry in Albany. Dr. Winter's out on Cross Keys Drive. And as I said earlier, the doctor has been a part of my radio show since back in '07. He's just a wonderful guest on the radio, and I knew he'd enjoy coming in here and talking for a little bit today, so we invited him. Now, I want you to know a little bit more about the doctor, because he's not only the king of sedation dentistry and make sure everybody's comfortable when they come in, and has a full clientele. I mean, he's not out looking for clients. He's got tons of them, okay? But he also does things for aftercare, like Botox and Juvederm. Let's talk a little bit about that, because I guess what happened, if I remember correctly, doctor, you said all these people came in, they wanted it afterwards, you didn't have it, so you went on and you developed the way to do it yourself, correct?
Well, yeah, kind of. You have to realize a lot of what I do is improving the appearances of patients with teeth, smiles, things like that. But if you take a Da Vinci or a Van Gogh and you look at the painting, it's fine. But what that painting really needs to sell it is a beautiful frame. Now, if you take a look at someone's lips, perhaps a middle-aged woman or a man who's got smoker's lines and these little marionette lines, the teeth are beautiful. Right. The teeth are gorgeous. I've just given them an incredible smile.
Right.
But this takes away from it. And if they have, say, like a high lip line when they smile and it's very gummy, you see a lot of gums?
Sure.
Use a little Botox will drop that down a little bit. Maybe some Botox will take away some of those smoker's lines. A little Juvederm will plump up those lips. Put the frame around that smile. And that's really where it brings it home, as you say. It's a great thing.
I listen to you describe this, and I got to tell you, you are a beautiful human being. Listen, this is just
I'll tell my
about
wife
as good
you
as it
said
gets.
that.
My God, that's good. But so many people, I was really surprised the morning the doctor started telling me about it, and started telling me about all the people that asked for it. They want it all done there, right?
Well, it's convenient. I mean, this is kind of where I'm working.
You're right.
If you think about it.
Well, you're working.
I'm working here and here.
Right.
And Botox, for instance, is not only used for cosmetics. Everyone knows Botox, for
Everybody's
the
heard about it,
wrinkles
right.
and all that stuff, and the Juvederm for the lips and the creases and everything, which is fine. It's wonderful. But a lot of Botox, for instance, can be used therapeutically for people who have joint problems, little grinding, little clenching where the muscles are really tight. Botox here, a little Botox in the grinding and chewing muscles up here. It takes a little bit of the edge off, and you don't grind as much, and you don't have some of those headaches. It doesn't work. I can't guarantee that, but it is an approved therapeutic use of Botox for something like that, perhaps in conjunction with other things as well, like mouth guards,
Yeah, right.
what have you.
Talk to me, if you don't mind, about the new client. Maybe it's the client over 40. You mentioned Botox, Juvederm, implants are available.
Implants.
The client is coming in a much better informed, right?
Right.
They're on the internet.
Absolutely.
They look what's available to them, and then they reach out for the service in most cases.
That's right.
today, right?
Yeah.
And all these services you can provide.
For the most part, more
Right.
or less, yeah.
Right. I felt that I don't know, but it sounds like implants are a tall order. Is that the truth?
Implants have really come into their own
Oh, they have.
over the last 10 years maybe, or more. When I first started in this field about 20 years ago,
Right.
implants were really sketchy in terms of how successful they were
Sure.
going to be long term.
Right.
Well, it's pretty much an accepted science now, and an accepted practice in almost any dental office with the proper training. Implants are a viable alternative to just an extraction and a bridge. You can have an implant instead, or if you have no teeth left and you're wearing dentures that you just can't take it, you can have implants for the most part, depending on your bony situation under the gums. You could have implants put in where you can stick the teeth in, the denture, the bridge, whatever, and it doesn't move, and you can smile with confidence, and you can chew with comfort, and all that stuff. So yeah, it's just taken a leap forward, and there are so many companies out there that can offer different types of implants, and they have 3D and milling of certain custom-made stuff. It's a big thing.
I'm always, we talk about all the things you do, from sedation to Novocaine to Juvederm to Botox to implants, all these things. The truth is, at the end of the day, being a dentist is still being a dentist, right?
It's still, you got to get in there, you got to do the work. They still don't like what you
pull
do,
the teeth.
and that's it. But
Yeah.
you know what? I have to be honest with you. I'm a lucky guy. I feel you've been to my office.
Oh, yeah.
You know what it's
I've done
like
my
there.
radio show at
You've
your
done the show there. I approach it with the attitude of, my friends are going to come to visit me, and while they're here, I'll take care of their teeth.
Right.
And we go, and that's where I want them to be. When I sedate a patient, they don't know me from a hole in the wall.
Sure.
They're coming to me, they're scared, they're just hoping I can take care of something, and I tried to. And my goal with someone like that is that I'll take care of them, I'll finish with them, they'll realize I didn't kill them, it wasn't as bad as they thought it would be, and I wean them off in time, so that they can come back to me and get what they need and not have to worry about being sedated, because there's that comfort level, because I've established the relationship. We're almost on a first name basis. They can call me whenever they want.
Sure.
And it's great. I'm there early, I leave late, I love it.
And you've been doing this for how long? About 20 years, right?
Truth be told, I graduated dental school in 1981.
Okay.
That's 30 something, what is it, almost 32 years, almost 31 years ago.
And
I did a residency here at Albany Med.
Right.
And I set up practice here, and I'm still practicing, trying to get it right.
And you're still here.
I'm still here.
Well, you're making a lot of people happy all the time.
That's nice.
A lot of people. We know a lot of people,
Thank you.
certainly through the radio station, that have gone to you, and they all speak highly of you. And you're really just a fun guy to have around. I enjoy when you do the radio show.
We're a fun office too. Today, I don't know, something was in the air. I think there was a laughing gas leak or something, but today, there was practical joke day today, and they got me too. Two of my staff members got me, and I love them.
I'm going to, one more quick thing before you go. Because I've worked with the legal profession, I've worked with doctors, I've worked with dentists, obviously. The world has changed when it comes to getting your message out, hasn't it? You just can't show up at the office anymore. You gotta let people know who you are in today's world, don't you?
There's the advertising, there's radio, there's TV, there's Facebook, there's YouTube, there's anything. Website. If you don't have a website, you're dead in the.
And that's interesting, because the doctor and I talked about that before. I always tell people, no matter what I'm selling on the radio, I always tell them the first thing people do when they know about your service and may want to use it is go to your website.
Go to the website.
It doesn't matter who or what you're selling. They go to the website first.
Or if you want to just look something up, I'll ask every patient when they come in, where'd you hear about me? Or they'll get the questionnaire, where did you hear about the office? And invariably, the website's in there, more often than not.
Your first impression in today's world, if you're doing business, isn't face-to-face anymore. It's your website.
That's right.
And I know you've been out front on the Facebooking.
Yeah.
And I'm sure you're getting a lot of hits on there too.
Yeah,
Facebook, website especially though. You got a good website.
Thank you.
The doctor's website, where it talks about sedation dentistry a lot, is very comprehensive. If you go there, albanyssedationdentist.com, albanyssedationdentist.com, you're going to find out all you need to know about Dr. Winter, who's on my show the first Monday of every month, which is next Monday morning at 6:30. I squeeze him in before. He probably usually has a 7 o'clock.
I come here, have a cup of coffee, then go to work.
And it's always fun. It's great to have him. And, I want to make sure we got you in, because if you don't mind, we're going to call you to come back. I mean, I love having you on. I love having you on, and we're going to get you back. You'll be on the radio show on Monday.
Thank you.
And it's a thrill to have you here. Any final words for everybody before you go?
Brush and floss. Really, this is. I mean, the easier you make it for me, the more you do at home, the easier my job is, which means it's easier for you as well, and probably a lot cheaper too. Just do what you're supposed to do.
Great to see you. I'll see you Monday morning. Dr. Harvey Winter, everybody, the king of Albany's, the king of sedation dentistry here in Albany. AlbanySedationDentist.com. You'll find Dr. Winter. We'll come back, wrap it up. I'll tell you about tomorrow's show in a moment here on My 4 Albany. Stay with us.